All right, great. So we have Larissa with us today. Larissa, can you please state your full name and the organization that you currently work for?
My name's Larissa Renee Jackson, and I work for the Cleveland Clinic, the philanthropy part of the Cleveland Clinic.
Oh, okay. That's wonderful. Well, thank you so much for being here today. Thank you for joining us for this podcast and for being here for CHW Day. I hope you're enjoying it so far.
Absolutely. It's nothing like recognition when you're out on the pavement helping people.
Absolutely. Absolutely. So I think one of the questions I'd love to start with is, what kind of advice would you give to someone who's considering becoming a community health worker themselves?
In general, I would overall research the actual position to connect with the criteria based on the organization that you're looking to work for. Most importantly, reflect upon your journey and where you've been, because it's critical to being in the community, working with people, that you're able to offer and listen effectively. The challenge that comes with the work is the adjustment, having to adjust to change. So make that a part of your to-do as well. Mm-hmm. That's critical to what we do.
And that's understandable, because with everything that just so rapidly changes and all the different scenarios you may face as a community health worker, you sort of have to be prepared for anything, right?
Absolutely.
So it's interesting because you work in the philanthropy area at the Cleveland Clinic. So can you describe a day in the life of Larissa in the philanthropy department?
Oh, wow. So what's amazing, Libbey, about working for this organization, I always wanted to be a part of a philanthropic part of an organization because of the community and the way the dollars are generated. I don't look at the dollars as an individual because the people are more credible to the work that I do. However, being a part of the philanthropy, you get an opportunity with flexibility. It opens doors for other opportunities, and you connect with so many people that you didn't realize that are actually a main part or a main donor of the success of this organization. So that's what I really love most about it.
That's wonderful.
Yes.
So can you share with us a little bit about your why?
So my why is I was a single mom, and I always loved looking for resources. I was a single mom of 3 children, and they were stair-step. So my why is because it wasn't easy gathering those resources. I come from Fathom. I come from poverty. I come from homelessness. I come from possibly being in the healthcare system, childcare system. So I've seen a lot as a child, and I wanted to bring upon change, being a community health worker and just being resourceful. What's amazing, I work with chronic disease, Libbey, and I love that I work with chronic disease because a lot of these patients, I have an opportunity to educate them on lifestyle changes as well. So that's the reason why.
That's a critical piece of it, right?
It is.
Lifestyle changes to help reduce chronic disease.
Absolutely.
And unfortunately, that education is not always easy to find, especially credible education.
That is so true.
It's great that you are there as that resource for them.
That is so true.
That's wonderful. Well, is there anything else that you would like to share about just the day-to-day work and the amazing philanthropic work that you're doing too?
So my day is unpredictable, and this is what I like most about it. I have a variety of tasks that I must do, from OKRs to facilitating a You Change You class, entering data into RedCap with the organization, connecting people. I do a lot of home visits, so I spend a great deal of time on the streets. I do a lot of home visits. If I'm not able to connect with patients in the office, I meet people at the library. I meet them at the bread shop. I'll meet them on the corner. Whatever it's going to take to get what they need. And I find the follow-up is the more complicated piece to this. It's not the the initial visit. It's thereafter, because then I want to connect and make sure that what I provided them with, that is actually working. We want to close those social gaps and those healthcare gaps. So I work from two different sides.
Sure.
I do a Humana pilot for your social needs and healthcare gaps. So we want to make sure on the health side, they have their physical, they're getting their lab work, they're seeing the eye doctor, they're doing their dental visits. So on that side, it's fun because I can help schedule appointments, and I get credit when I help schedule those specialty appointments, or if I'm connecting them to a behavioral health specialist or anything of that nature. So that's what I like about the Humana side pilot of things. Okay. However, I work from the value-based side, where I'm working with our patients for their social drivers of health, which consist of financial, food, housing, transportation, and utilities. Most often I find that the older population, what they don't know, they don't go looking for it. So I'm that one that's advocating for them. And what's amazing, when you can get someone to believe in you, we're winning.
100%. 100%. I love this. And I love the very common thread line among a lot of the people we've talked to today has been meeting people where they're at.
Yeah.
When you said you'll meet someone at a corner in a library, you're meeting people where they are in terms of not just location, but their accessibility.
Absolutely. And I always think mind, body, and soul. It's a complete package.
100%.
It's like your whole body system. When we can put aside our differences and just listen, that's when you know that someone will honestly trust what you have for them. And they will call you. And I love that they call. But what's ironic, no one called me today, so they must have known I was going to be right here. I'm busy.
Yeah, see, they knew you were busy, helping to spread more cheer and the word to other people.
Yeah.
Well, wonderful. Thank you so much for joining us today, Larissa. This has been a wonderful conversation, and I really hope you've been enjoying CHW Day so far, and I hope you have a wonderful afternoon.
Thank you, Libbey. It was my pleasure meeting you today.
Thank you.